Good evening, guys. So, again, um, we're going to talk about our lecture for abnormal psychology through this audio lecture. I hope you can catch up with our topics or lessons. You are also free to message me with your queries or clarifications in terms of the things that I am discussing in here. And also, I would like to tell you that this is going to be the last lecture that I'm going to do, because on the following weeks, I will be asking you to do also your audio presentation or video presentation of your lecture in the topics that I assigned to you previously in our class. But then again, let us continue first with our discussion. So our topics to discuss are, number one, we're going to talk about the unipolar depression, or commonly known as the depressive disorder. So bakit siya unipolar? Because in this kind of disorder, there is one emotions that person is actually experiencing, and that is only being depressed. That is why unipolar depression. And then number two, we're going to talk about the bipolar disorders, which is also a very famous disorder. But sadly, the term bipolar is being used by many people without really knowing what really is it, or what does it take to have a bipolar disorder. It's just like nagiging common words yung bipolar, na nalilito yung mga tao in terms of really understanding people who are having bipolar disorders. So as a psychology student class, we have this responsibility to really educate those individuals regarding these terms or this kind of disorders, so that we could help yung mga tao that is really suffering from this kind of abnormality or situation. And then lastly, we're also going to talk about suicide. So bakit kasama sa yung suicide dito sa lecture topic natin, class, is because this situation is really and usually the pitfall of those individuals who are suffering from mood disorders like the unipolar depression and the bipolar disorders. So let us start, class. Let's begin with this story in which we could picture out what is really going on with someone who is suffering from a mood disorder. So, I will be reading it. Sundan nyo na lang ako, class. So, for a 6-month period, please take note the time also. For a 6-month period, her irritability bordered on the irrational. She screamed in anger or sobbed in despair at every dirt dish left on the coffee table or on the bedroom floor. Each day, the need to plan the dinner menu provoked or agonizing indecision. So, how could all the virtues, or more likely, vices of hamburgers be accurately compared to those of spaghetti? She had her whole family walking on eggs, so she thought they would be better off if she were dead. Beatrice could not cope with her job as a branch manager of a large chain store. She had many decisions to make. Unable to make them herself, she would ask employees who were much less competent for advice, but then she could not decide whose advice to take. Each morning before going to work, she complained of nausea. Beatrice's husband loved her, but he did not understand what was wrong. She would improve. He thought that she would improve if he made her life easier by taking over more housework, cooking, and childcare. His attempt to help only made Beatrice feel more guilty and worthless. She wanted to make a contribution to her family. She wanted to do chores like normal people did, but broke down crying at the smallest impediment to a perfect job. Months passed and Beatrice's problem became more serious. Some days she was too upset to go to work. She stopped seeing her friends. Okay? She spent most of her time at home either yelling or crying. Finally, Beatrice's husband called the psychiatrist and insisted that something was seriously wrong. So, in the story of Beatrice class, we could see how this kind of mood disorder is affecting the person by really being so helpless na kahit na may gusto siyang gawin na isang bagay, she doesn't seem to motivate or push herself to do so. Sinabi din dito that Beatrice is likely to make her family walk on eggs or on eggshells. It's like parang every move na gagawin ni Beatrice, she is really or she's going to hurt her family members because napaka-sensitive niya gawa nung mga nararamdaman niya sa sarili niya na hindi niya maintindihan bakit nagkakaroon siya ng ganong thoughts which is negatively by nature. That even though her husband really is willing to help her cope up with her experiences, hindi niya pa din ito ma-appreciate, no? Kabaligtaran pa nga pa yung nangyayari, mas lalo siyang nagiging feeling helpless and unworthy kasi nga hindi niya magawa yung trabaho niya as a manager, as a wife, and also as a mother to their children. So anyway, class, so let's talk about the description of a mood disorder. I know na with the story that we have read a while ago, you have a picture already that what's going on with the person herself kapag meron siyang mood disorder and how it is affecting the people around her, especially the family members and the people na nakakatrabaho niya. So, in our everyday life, it is really a roller coaster of emotions, class. So, you may feel on top of the world one day because of a high profile promotion or an awesome grade on tests. Another day, you may feel down in the dumps due to relationship problems, financial troubles, or because you got a flat tire on the day to work. But class, these feelings are actually normal fluctuations in the mood that come and go. So, since sinabing natin kanina that our life is a roller coaster of emotions, it is but normal for us to feel euphoric, sobrang saya, kapag nga we got something special, naka-receive tayo ng gift, kapag may isang bagay na nakuha natin na sobrang nakakapagpasaya sa atin. So, it would be abnormal naman, for example, nanalo ka sa loto ng 1 million and then, imbis na matuwa ka or mag-iiyak ka is, mag-iiyak ka sa tuwa is parang nalungkot ka pa. So, that is not normal. And also, it is also normal to feel bad, to cry, kapag may mga bagay tayo na hindi nakukuha or if something is hurting us or kapag nadi-disappoint tayo. So, normal yon. And those kind of emotions are actually come and go. And tayo, mga tao, are designed to really adapt with situations like that na kailangan na tayong makapag-cope up or malampasan natin yung mga bagay na yon. But then again, class, when your mood starts to have an impact on your daily activities and in your social, educational, and vocational relationships, you may be suffering from a mood disorder. So, kailan nagiging mood disorder ang ating nararamdaman na mga emotions? When the fluctuations of these emotions ay hindi na naging normal in accordance doon sa acceptable ng ating society. Again, I am talking about the norms. For example, class, okay, halimbawa bumagsak ka sa examination. So, it's just normal that you became sad over that. Pero, kapag yung pagiging sad mo dahil bumagsak ka sa examination mo last sem ay nadala mo hanggang gumraduate ka, hindi ka maka-move on, at dahil dun sa bagay na yon ayaw mo nang pumasok ng school, ayaw mo nang humarap ng tao, ayaw mo nang kumain, nangaaway ka na ng teachers mo. So that is abnormal, and that is actually a symptoms of you having a mood disorder, kasi nga hindi ka na naka-move on or hindi ka na naka-move forward. And also, class, wag natin pong kakalimutan yung 4Ds in psychology, which stands for danger, dysfunction, deviancy, and distress. So, kapag yung emotions mo ay nakakapag-inflict na ng danger towards yourself, towards other people, that could be a symptoms of a disorder. Kapag yung mood mo is actually making you so distressed already that you neglect your job and yourself as well, so that could be a symptoms of you having the disorder. So kapag yung mood mo is actually making you deviant, or napapansin na ng mga tao sa paligid mo parang nagbabago ka or hindi na normal yung kilos mo at kakaiba na to sa dating ikaw, so probably that is a symptom of disorder. And lastly, kapag mayroong deviancy, okay, ang kakaiba sa behavior mo, yun. So again, we have deviancy, we have danger, we have distress, and then we have dysfunction. Okay, class? So what is a mood disorder? Mood problems are at the center of two groups of disorders. Una, katulad nung pinag-aralan natin, we have the depressive disorders, or also known as the unipolar depression, and then we have the bipolar disorder. So, people with depressive disorders suffer only from depression, and this is called the unipolar depression. This kind of disorder have no history of mania, and they return to a normal or nearly normal mood when their depression lifts. In contrast, when we say bipolar disorder, these people experience periods of mania that alternate with periods of depression. Plus, when we say mania, this is when a person literally shows a very happy emotions, na yung happiness level niya is level 10 that lasts for at least a week, na kahit wala naman siyang dapat ika-happy, makikita mo na there is an exaggeration of the happiness of this person and masyado siya talagang active. So anyway, bipolar disorder, meron siyang mania, overly active, and then all of a sudden, bigla naman siyang magiging depressed. Okay, next class. So when your mood starts to have an impact on your daily activities and in your social, educational, and vocational relationships, you may be suffering from a mood disorder. Again, yung 4D natin, tatandaan. So let's talk about deeper on the unipolar depression or the depressive disorders. So let us first decode the meaning of these important terms. So let's start last with depression. When we say depression, this is a low, sad state marked by significant levels of sadness, lack of energy, low self-worth, guilt, or related symptoms. So this is self-explanatory. When you are feeling this kind of emotions for at least 1 week without knowing what's going on, it's good for you to really talk to people already. At kapag naman yung ganitong situation ay nag-last for 6 months, that person could be diagnosed having a depression, quote-unquote, disorder. Next is, let's understand what is mania. A mania, class, is a state or episode of euphoria Again, when you say euphoria, this is a heightened happy emotions or frenzied activity in which people may have an exaggerated belief that the world is theirs for the taking. So, yung pinaliwanag doon, yung exaggerated belief that the world is theirs for the taking, ang tao na nakakaranas ng mania is actually having an episode of, what they call this, delusion. Nagiging delusional sila. They tend to believe something, no, na walang basis. And then we have the depressive with quote-unquote disorders na. These are the group of disorder marked by unipolar depression or yung pinapaliwanag dito kanina. Then next we have the unipolar depression. Ang unipolar depression or depression without a history of mania. So, ang unipolar depression, these are people who are only on the downside of their emotions. And then lastly, class, we have the bipolar disorder. Bi meaning two, polar, poles, dalawang side. Okay? So, bi. Disorders marked by alternating or intermixed periods of mania and depression. Ang tao, class, na may bipolar disorder, sometimes they have these episodes of being overly sad, yung depression na tinatawag. And then, on the other day, bigla naman overly active sila, madali mong matatandaan. And ang mahirap, in times, pwedeng mag-intermix or magsabay yung dalawang emotions that makes them really crazy because it's not really normal in the perspective of other people. And then po, class, ang sunod po nito, we have the how common unipolar depression is. Basahin po natin, sorry. So, I don't know how to erase this red mark. Sorry, class. So, how common is unipolar depression? So, this data actually coming from United States. It says here that 80% of adults in the United States suffer from a severe unipolar pattern of depression in any given year, while as many as 5% suffer from mild forms. 8% is many, ha. Around 19% of all adults experience an episode of severe unipolar depression at some point in their lives. So, these prevalence rates are similar in Canada, England, and France. So, class, if we're going to notice, United States, Canada, England, France are one or the top countries na pwede nating sabihin they are really productive and also top country worldwide. But then again, meron pa din sa kanilang mga tao that is suffering from depression kahit nakagaano pa ka-successful and nag-a-aspire yung mga tao na manirahan sa ganitong country because nga maganda yung economy. So anyway, moreover, the rate of depression, mild or severe, is higher among poor people than wealthier people. So dito nga magtataka tayo why people are getting depressed in this country whereas sila yung mga ang tawag dito, yung mga nangunguna sa mga bansa. And the statistics is saying na mas nagkakaroon ng probability ang mga mahihirap na tao to feel depressed rather than wealthier ones. Kasi yun nga, ang mga mahihirap na tao, ganyan, most of the time, they feel helpless, no? They don't know kung saan kukunin yung pagkain nila in a day. So, that's small needs which is necessary, nagiging problema nila araw-araw, unlike the wealthy people. Anyway, women are at least twice as likely as men to experience episodes of severe unipolar depression. So, mas marami sa mga babae. As many as 26% of women may have an episode at some time in their lives compared with 12% of men. As you will see in other chapter of the book, among children, yung book na ginamit ko dito, class, yung ibinigay ko po sa inyo. Among children, the prevalence of unipolar depression is similar for girls and boys. So, kapag bata, wala naman ganun ka-significant difference with the experience of unipolar depression. Pero with adults, mas susceptible na magkaroon ng unipolar depression yung mga babae. Approximately 85% of people with unipolar depression recover, some without treatment. Around 40% of them have at least one other episode of depression later in their lives. So, makikita natin dito, class, na it's a good thing na nung yung mga tao na nagkakaroon ng unipolar depression, 85% naman sa kanila nakaka-recover without any medication or treatment na ginagawa, because nga sometimes we really tends to get to have those symptoms of depression because of the severity ng mga na-experience nating difficulty in our lives. So, moreover, class, what are the symptoms of depression? So, there are really this pictures of people or emotions of people who are having a depression, yung dying inside, yung malungkot na malungkot pero nagagawa pa ding tumawa, but then again, yung aura ba nung tao, makikita mo talaga that there is something wrong. So, una, pag-usapan po natin yung emotional symptoms ng tao na may unipolar depression. So, most people who are depressed feel sad and dejected. So, eto yung pinaka-source talaga why people are having depressive symptoms is when they felt na they are not welcomed in a society, in a group. Kaya nga, class, sana wag tayong maging mean girls and mean boys to actually anong tawag dito, i-outcast natin yung mga tao sa paligid natin just because it feels like hindi sila nababagay sa grupo mo or whatsoever. So, they describe themselves as feeling miserable, empty, and humiliated. They tend to lose their sense of humor, report getting little pleasure from anything, and in some cases, display anhedonia. When we say anhedonia, class, sorry about that, sorry, hindi ko na yung mababago. When we say anhedonia, class, it is an inability to experience any pleasure at all. So, kahit na anong gawin mong pagpapasaya sa tao, isama mo yan sa mall, manood ng movie na joke time, bakainin mo ng paborito niyang pagkain, there is really no way for them to be happy kasi they lose interest already with anything. Wala nang pleasure silang nararamdaman. A number also experience anxiety, anger, or agitation. So, this is from Brown 2010. So, this sea of misery may lead to crying spells. And, yeah, they wish to really escape this misery and sadness. Thus, most of the people experiencing depression tends to commit suicide. So, that's a sad thing. Next, we have the motivational symptoms, class. So, depressed people typically lose the desire to pursue their usual activities. Almost all report a lack of drive, initiative, and spontaneity. So, people with depression doesn't have any motivations at all. Hindi na sila, lagi na lang silang tulog. Bakit sila laging tulog? Because they really have this lack of energy to do anything at all. Kahit pagkain, wala na, hindi na sila na-motivate para gawin ito. Parang ang nakikita nila sa paligid nila are all black. Ganyan. Hindi na nila na ma-realize what is the importance of still having a house na natutuluyan, pagkain nakakain, pera, nakakapasok sa school. That is why nga, class, when people are really being depressed, it's not really good din na ang sasabihin natin, okay lang yan, buti nga ikaw may nakakain pa, buti nga ikaw may pagkain pa, buti nga ikaw nakakaaral pa. Kasi this is really the thing that you don't want to tell those people suffering from depression. Kasi nga, even those things are really not making them become motivated to continue their lives. So, they may have to force themselves to go to work, talk with friends, eat meals, or have sex. But then again, hindi siya naglalast long. Okay? Wala nga kasing spontaneity. Okay, sobrang displeasure na sila. So, a description of this one is etong nasa libro po natin. Sabi dito, I woke up one morning with a knot of fear in my stomach, so crippling that I couldn't face light, much less day, and so intense that I stayed in bed for 3 days with the shades drawn and the lights out. 3 days not answering the phone, 3 days not checking the email. I was disconnected completely from the outside world and I didn't care. Then on the morning of the fourth day, there was a knock on my door. Since I hadn't ordered food, I ignored it. The knocking kept up and I kept ignoring it. I heard the sound of keys rattling in my front door. Slowly, the bedroom door opened and in the painful light from the doorway, I saw the figures of two old friends. Terry, are you in there? So, kahit eto, yung nangyari kay Terry class is that she didn't even know what is happening around her. Hindi niya alam na kung bakit yung dalawa niyang friends hinahanap na siya. So, wala na din siyang sense of time and wala na din siyang sense of gabi na ba, umaga na ba. Kasi nga, sobrang wala na siyang pakialam sa mundo niya. Next. And, yung katulad ng sinabi ko, class kanina, when you're having this kind of symptoms, ang nasa isip lang ng tao na nakakaranas ng ganitong mga pangyayari is to commit a suicide. So, it just represents the ultimate escape from life's challenges. So, it is anchored with the concept ng Thanatos ni Sigmund Freud, the death instinct, that actually dying is an escape from the misfortunes, difficulties, and problems in life. So, ito yung naiisip ng mga tao because according kay Freud, we are really motivated to enjoy life and to find pleasure, thus the libido. So, kapag hindi ka na nakakakita ng pleasure, so you're just going to escape, which is, again, the Thanatos. And suicide is a tool to actually achieve Thanatos. But class, again, this is a no sana. We don't want our friends, our family members, or ourselves to end up committing suicide just because we don't know how to handle it, or we don't know why we are experiencing this kind of symptoms. So, other symptoms of depression is behavioral class. So, depressed people are usually less active and less productive. So, they spend more time alone and may stay in bed for long periods. So, an example is yung lalaki na may depression, sabi niya, I waken early but I just lie there. What was the use of getting up to a miserable day? So, pagkagising niya, ang gagawin niya, imbis na kakain, mahihiga na lang siya ulit and matatapos yung buong araw niya na nasa higaan lang. Depressed people may also move and even speak more slowly. You will see that people who are depressed, parang ang kupad-kupad niyang kumilos, na kahit na, for example, baka may classmate kayo na kahit na sabihin na ganito yung deadline, ayaw niyang gawin, na kailangan mo makapasa, yung kahit na anong encouragement yung gawin mo, wala siyang pakialam. So, check on that person kasi probably nagkakaroon siya ng episode of being depressed, and we wanted to know what makes him or her behaving like that class. And then we also have the cognitive symptoms. So, depressed people class hold extremely negative views of themselves. Kalimitan ng mga tao na susceptible with depression are the ones with very low self-esteem and then self-worth. So, probably because all throughout their life, their parents failed to encourage them to do their best sa mga activities na ginagawa nila. Or minsan naman, katulad nung sinabi ni Erik Erikson na pagbata, kailangan kapag may ginawa siyang tama or maganda, kailangan laging merong recognition or affirmation na yung ginawa niya is actually a very good one. Kasi yung mga bagay na yun, yung nakakapagpataas ng self-esteem ng mga bata. So, nakakadagdag yun ng kumpiyansa nila sa sarili nila. So, dapat, naniniwala ako na bata pa lang, you should actually recognize and affirm the good things that the child is doing, no? Kasi makakatulong ito para mas maging buo yung pagkatao nila, no? In terms naman na pag nagkakamali yung isang bata, it's not really advisable to swear on them or sabihan mo sila ng mga bagay na pangit. You could actually hindi mo naman kailangang utuin yung bata or lokohin na okay lang yan, no? Ang gagawin mo, i-point out mo yung pagkakamali niya kasi baka magkaroon naman ng false interpretation yung bata na just because ina-accept mo yung pagkakamali niya na pwede na siyang magkamali all over or maging lack sa mga bagay na gagawin niya. So, point out mo yung mali ng bata. And then, ang pinaka-importante sa lahat, show the child how to do the things properly. Hindi pwede yung pinapagalitan mo lang. Dapat kapag may tinuturo kang mali, alam mo din kung paano ituro yung tama. And so, ma-improve niya yung ginagawa niya. So, class, that's the way you actually build confidence and the self-esteem of a person, no? Simula yan sa pagkabata. So, kayo din, ganun din yung gagawin nyo. So, they always blame themselves, they are pessimism, all negative things are in their minds. So, because they expect the worst, they are likely to procrastinate. Their sense of hopelessness and helplessness makes them especially vulnerable to suicidal thinking. Dahil nga, masyado ng negative yung outlook nila sa buhay, feeling nila wala ng hope, wala nang way out with their misery and problems, so they are thinking of committing suicide. People with depression frequently complain that their intellectual ability is poor. Na, yun nga, kasi nga, they cannot reason out, hindi nila maisip paano i-solve yung problem nila. And so, that is one of the symptoms, class, ng unipolar depression. So, again, makikita mo dito, the symptoms are really a combination of the different factors, again, na nag-i-interplay sa psychology. So, again, we have the emotional, we have the motivational, and then we have the behavior. You could see that in their way of thinking. We have the cognitive. So, now, let's talk about how to diagnose person with unipolar depression using the DSM-5. So, in our DSM-5, a major depressive episode is a period of 2 or more weeks marked by at least 5 symptoms of depression, including sad mood and loss of pleasure, or what we call again anhedonia. In extreme cases, the episode may include psychotic symptoms, one marked by a loss of contact with reality such as delusion. Okay, they believe something without really basis. Bizarre ideas without foundations, or hallucinations. So when you say hallucinations, this has something to do with our sensations. So perceptions of things that are not actually present. So people with hallucination are seeing things na siya lang yung nakakakita at hindi nakikita ng ibang tao. Nakakarinig, nakakaramdam. No, yung delusion naman, it's more on the thinking, yung wrong belief nila about something, which is very much different with majority of the people. So, dun papasok yung norms. So, this are several types of depressive disorders as listed in the DSM-5. So, we have the MDD, or the major depressive disorder. So, people who experience a major depressive episode without having any history of mania. Okay, wala siyang mania, ibig sabihin walang happy thoughts. Number 2, we have the dysthymic disorder. So these are individuals who experience a longer lasting, for at least 2 years, but typically less disabling pattern of unipolar depression. So class, kapag yung symptoms ng depression ng isang tao is hindi siya umabot doon sa qualification ng MDD or ng Major Depressive Disorder. So, yun po ay ika-classify natin as dysthymic disorder. Number 3, we have the PMDD or the premenstrual dysphoric disorder, which is typically, of course, for women. So, a diagnosis given to certain women who repeatedly experience clinically significant depressive and related symptoms during the week before their menstruation. So, class, baka magkamali naman tayo dito. No, during the menstruation of female, nakakaramdam talaga tayo ng feeling of helplessness or weakness, pero tandaan natin yung 4D. Kung hindi naman siya nagkakaroon ng symptoms na papasok dun sa 4D na nakaka-danger na sa sarili natin, meron ng distress, meron ng deviancy, meron ng dysfunction, so baka naman lighter, normal symptoms ng pagkakaroon ng menstruation. Pero kapag exaggerated na, so that's probably a type of depressive disorder. And then we have the DMDD. So this is the disruptive mood dysregulation disorder, characterized by a combination of persistent depressive symptoms and recurrent outbursts of severe temper. So, yung disruptive mood dysregulation disorder, this is when you are depressed, and because you are depressed, nagkakaroon ka ng episode ng pagiging, ang tawag dito, agitated, yung magagalitin, no? Yung kunyari, natutulog ka maghapon, tapos biglang gigisingin ka ng mama mo kasi nag-aalala sa'yo, bigla ka nalang mananapak, no? Or bigla ka nalang magwawala. So, that is a depression with outbursts of exaggerated temper. So, yan class yung ating unipolar disorder. And then, unipolar depression. So, more on diagnosing unipolar depression. So, eto po, yung iba't ibang types. So, nakalista dito, DSM-5 base, yung checklist ng pagkakaroon ng major depressive disorder or the MDD, and then we have the dysthymic disorder as well. So tatandaan nyo po class na mas malala again yung MDD, no, kaysa dun sa dysthymic, kasi yung dysthymic hindi niya talaga na-reach yung mga requirements doon sa MDD. Okay? And what else? Ayan. For years, it was thought that low activity of either norepinephrine or serotonin was capable of producing depression. So, but investigators now believe that their relation to depression is more complicated. Noong mga unang panahon kasi, when the medical doctors are studying the reason behind unipolar depression, they say na this has something to do with the activity of a certain hormone. Ito nga, itong norepinephrine and serotonin. Pero, sinasabi nila na there should be more study about it kasi mas complicated yung role nila into producing or producing a unipolar depression. So the research suggests that interactions between serotonin and norepinephrine activity or between this and other kinds of neurotransmitter in the brain rather than the operation of any one neurotransmitter alone may account for unipolar depression. So if you could see here class on table 6.2 comparing disorders of mood, no, yung MDD or major depressive disorder class is mas prevalent sa mga babae kaysa sa mga lalaki. So, every 2 female na may MDD, isa naman sa lalaki. Ang onset ng age, tandaan nyo, 24 to 29 years old. Usually kasi this is a young adult stage wherein there are so many expectations sa mga young adult, and also this is the time whereas the society expected these individuals to live independently, yung hindi yung mga young adults, hindi na sila nakadepende dun sa mga magulang nila. It's like, they need to decide on themselves, they need to solve their problems independently. So, yung life for them is quite difficult as compare yung mga teenager years nila na na mas open pa sila to talk about their difficulties sa mga magulang nila, and the society doesn't expect more unto them. Yung dysthymic disorder naman, mas marami pa din sa babae. So usually meron to 10 years old to 25 years old. And we're going to talk about bipolar 1, bipolar 2, and cyclothymic disorder in other slides. Okay, so mag-stop muna tayo dito para hindi po kayo malito. Okay, so unipolar depression, the depressive disorder, we're still here. So what are the treatments naman? So biological treatment ng unipolar depression class. So we have the ECT or the electroconvulsive therapy. Ito yung madalas na po natin pinag-uusapan, yung kinukuryente nila, no? Kasi sabi nila, people with some disorders in this particular disorder, ito nga pong unipolar depression, yung parang electric wire, yung mga nerves sa brain natin na parang nagiging kumpul-kumpul sila. That's why you need to undergo this into electroconvulsive therapy para bumalik sa ayos, no? In this procedure, 2 electrodes are attached to the patient's head and 65 to 140 volts of electricity are passed through the brain for a half second or less. So this results in a brain seizure that lasts from 25 seconds to a few minutes. After 6 to 12 such treatments spaced over 2 to 4 weeks, most patients feel less depressed. So this is what the study are saying, class. So other biological treatments for unipolar disorder are by taking the antidepressant drugs. So we have 2 kinds of drugs discovered in the 1950. Ito po, ayan, the monoamine oxidase inhibitors and the tricyclics. These drugs have now been joined by a third group, the so-called second generation antidepressant. So we have class D, the MAO or the monoamine oxidase inhibitors. We have the tricyclic. Okay, ito po yung pinakasikat. Okay, ngayon, yung tinatawag na SSRI or the selective serotonin reuptake inhibitors, mostly ginagamit ngayon ng mga medical doctors to treat depression. So, ayan po. Madalas nyo yung naririnig or kapag nag-board exam kayo, lalabas palagi itong SSRI. Okay, class? So, yan po. Diyan nagtatapos yung ating unipolar depression or the depressive disorder. Okay tayo? So, pwede po kayong mag-break. Now, let's go with bipolar disorders na, class. Okay, in bipolar disorders, there is actually an interchange of mood. Yung kanina kasi isa lang, more on low emotion. Dito, sometimes you feel euphoric or sobrang saya, and then other times you feel so depressed, or minsan nagkakasabay pa silang dalawa, that people find it really crazy kasi nga ang bilis mag-shift ng emotions without any reasons at all. So bipolar disorder class is formally called the manic depressive illness or manic depression. So it is a mental disorder that causes unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day-to-day tasks. So these moods range from periods of extreme up or elated, irritable or energized behavior known as manic episodes to very down, sad, indifferent, or hopeless periods known as the depressive episodes. So, less severe manic periods are known as hypomanic episodes. Class, please take note na kailangan yung maintindihan po what is the difference between the manic and the hypomanic episodes. Kasi importante po ito sa identification ng bipolar 1 at ng bipolar 2 disorder. Kapag po sinabi nating manic or mania, this is when a person experience happy emotions, overly happy emotions, euphoria in a week. So, ganun siya nag-last 1 week na nasa elated mood ka. And then, kapag hypomania naman, usually, yung episode ng euphoria is 2 to 4 days lang. Okay? Yung hypomanic, 2 to 4 days of elated mood, whereas yung mania po ay 1 week. So, tandaan nyo po yan. So, we have 3 types of bipolar disorder. All 3 types involve clear changes in mood, energy, and activity levels. So, we have the bipolar 1 disorder, the bipolar 2 disorder, and then we have the cyclothymic disorder, or also called cyclothymia. So, let's do this, class. For bipolar 1 disorder, it is defined by manic episodes that last at least 7 days. Ayan po, pag 7 days or naka 1 week, we call that manic episodes, mania. Or by manic symptoms that are so severe that a person needs immediate hospital care. So usually, depressive episodes occur as well, typically lasting at least 2 weeks. So, delikado kapag nasa euphoric state ka ng 2 weeks kasi sa sobrang active mo, baka sa sobrang galaw-gaw mo or napaka-impulsive ng kilos mo, pwede kang pwede kang ma-put into danger. Okay? Nasayaw ka ng sayaw, hindi mo alam, mahulog ka na ng hagdan. Okay? Something like that, class. So, episodes of depression with mixed features, having depressive symptoms and manic symptoms at the same time are also possible. So, in bipolar 1 disorder, again, meron kang episode ng mania, elated mood na naglalas ng 7 weeks, and then makaka-experience ka din ng depressive symptoms. Let's go with bipolar 2 disorder. This is defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes that are typical of bipolar 1 disorder. Class, sa bipolar 2 disorder naman, usually magkakaroon or makakaranas yung tao ng isang depressive episodes, and then meron naman siya na hypomanic episodes. So, ibig sabihin, yung elated mood niya, naglalas lang ng 2 to 4 days. Hindi katulad ng bipolar 1 na full-blown yung pagkakaroon niya ng heightened emotions. So, sa bipolar 2, hypomanic lang at saka depressive disorder. Ulit, ang bipolar 1, meron siyang mania at meron siyang depressive disorder. Whereas sa bipolar 2, meron siyang depressive disorder and meron siyang hypomania. And then we have the cyclothymic disorder. This is defined by periods of hypomanic symptoms as well as periods of depressive symptoms lasting for at least 2 years. So 1 year in children and adolescents. So, sa mga bata at sa mga teenagers, yung periods of depressive symptoms and hypomanic symptoms naglalas ng 1 taon. Pag matanda, 2 years. So, bakit siya cyclothymic disorder? Kasi the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. Ibig sabihin, yung episode ng pagkakaroon ng depression sa cyclothymic disorder ay hindi niya naabot yung buong requirements for someone with depressive disorder. Kumbaga, kung 5 yung requirements para masabi mo na meron kang depressive disorder, kung 3 lang yung lumalabas na symptoms sa'yo, so, doon ka lang magfa-fall sa cyclothymic disorder. The same way na ang cyclothymic disorder, although they are experiencing hypomanic episodes, hindi niya ganong naabot yung requirements of having a hypomanic. Okay, so, pwede nating sabihin that cyclothymic disorder class is a less severe version ng bipolar 2 disorder. So, sana hindi po kayo nalito dito. You could actually, again, message me kapag may mga tanong. Okay? So these are the sign and symptoms of people who are having a bipolar disorder. So people having a manic episode may, yun sa blue corner class, feel very up, high, elated, irritable or touchy, feel jumpy or wired. So that's why it could danger them. Have a decreased need for sleep, gising, laging gising, parang 1 hour lang okay na. Pansinin niyo yung mga tao class na minsan walang tulog, para silang addicted, parang laging high. So have a loss of appetite, talk very fast about a lot of different things, feel like their thoughts are racing. So when you say feel like thoughts are racing, parang ang dami lang iniisip, ang dami nilang plano, no? To the point na sa sobrang ang dami naglalaro sa isip nila, the way they really talk are actually mixing up. Napansin niyo yung sa sobrang tatalino yung classmates or sobrang tatalinong professor, sometimes na sa sobrang daming nangyayari dun sa utak nila, hindi talaga nila maisabi or may express clearly because nga yung overly active nung kanilang brain thoughts. So think they can do a lot of things at once, do risky things that show poor judgment, such as eat and drink excessively, spend or give away a lot of money, or have reckless sex. Feel like they're unusually important, talented, or powerful. So, dito naman, nakita nyo kanina, yung mga merong unipolar depressions, they lack self-worth and self-esteem. Yung mga tao naman na nasa manic episode, umuay naman yung believe nila sa sarili nila, na sometimes nagkakaroon sila ng delusion na kaya nilang lumapad, kaya nilang tawinin ng dagat. So, yan mga symptoms. Dito sa yellow side class, eto naman yung people having a depressive episode. So, they may feel very sad, down, empty, worried, or hopeless, feel slowed down or restless, have trouble falling asleep, wake up too early, or sleep too much, laging tulog, tapos minsan madali naman magising and then babalik lang sa pagtulog, experience increased appetite and weight gain, talk very slowly, feel like they have nothing to say and forget a lot, have trouble concentrating or making decisions, feel unable to do even simple things, have little interest in almost all activities, a decrease or absent sex drive, or inability to experience pleasure, once again anhedonia. So feel hopeless or worthless and think about death or suicide. Imagine people class having a bipolar disorder na tong dalawang symptoms na to, yung manic at saka yung depressive, is nag-i-interchange, no? Talagang people will tend to go crazy kapag ganito kabilis mag-shift yung emotions po natin. So, understood? And this class are the signs and symptoms of people with manic episode. Sorry. Hindi ko na masyadong babasahin. Kayo na magbasa nito, class. Ayan. Pakibasa po ito. This is for manic episode, bipolar 1, and bipolar 2 disorder, which is written in our DSM-5. We don't really have to, class, we don't really have to memorize what is written in DSM-5 kasi you can have that while, while attending your client, no? Or kapag nagda-diagnose kayo, ang kailangan niyo lang tandaan kapag magda-diagnose is yung age onset, kasi nga minsan kapag matanda 2 years, and then sa bata 1 year lang, and also usually mga 6 months yung naglalas yung symptoms. Okay? Next, these are the treatment naman for bipolar disorder. So, bipolar disorder is very treatable. So, medication alone or a combination of talk therapy or psychotherapy and medication are often used to manage the disorder over time. So, talk with your counselors. Medications known as mood stabilizer are the most commonly prescribed type of medication for bipolar disorder. So, anticonvulsant medications are also sometimes used. What does anticonvulsant medications are doing, class? So, this is like giving you a calm effect, pampakalma yung anticonvulsant disorder. So, malimit tong ginagawa kapag yung isang tao ay nandoon sa episode ng mania. So, pinapadecrease niya yung activity ng brain ng isang tao, anticonvulsant. And then, katulad doon sa unipolar depression, ginagamit din yung electroconvulsive therapy or the ECT. Okay? And then, since bipolar disorder can cause serious disruptions and create an intensely stressful family situation, family members may also benefit from professional resources, particularly mental health advocacy and support groups. So, class, ang tawag po dito is yung family therapy, yung mga merong support group. Kasi, we cannot really be successful in treating person with bipolar disorder kung aasa lang tayo doon mismo sa tao na may sakit or yung merong disorder himself or herself. It's very important the people around them are open-minded and are also accepting doon sa situation or disorder na meron yung kapamilya nila, kasi they really are needed in order to help these individuals overcome what they are going through. Thus, the support group is very important. Okay, so that ends our explanation, class, nung ating disorder. Again, we talk about the unipolar depression, and then we talk about the bipolar disorder, which is 3 types. We have the bipolar 1, bipolar 2, and then the cyclothymia. And then in unipolar depression, we have 4 types. We have the major depressive disorder, we have the unipolar depression, we have the premenstrual depression disorder, and then the other one, yung mood dysregulation depression disorder. So, i-check nyo yung slide natin. Meron tayong 4 sa unipolar, and then meron tayong 3 sa bipolar disorder. And moreover, on this discussion, class, we're going to talk about, again, tulad ng sinabi ko sa kanina, yung suicide. Why? Because most people na nakakaranas ng mood disorders, ang tanging escape nila for this shift of emotions are actually to end their life. So, parang tinatakasan nila. And mind you guys, people who are committing suicides are actually afraid of dying. It's just that sa sobrang pain na nararamdaman nila dahil dun sa naiisip nila about themselves na worthless sila, o kaya yung nafe-feel nila na rejection. So parang they cannot do anything anymore but to escape those kind of feelings. So in this topic, we're going to talk about the definition of suicide, and then what triggers a suicide, what are the underlying causes of suicide, and then is suicide linked to age, or children are committing suicide. Meron na po tayo na mga articles and also sa mga news na bata nagsisuicide. So the treatment of suicide, so let's try to talk about this one, no, class, para magkaroon naman po tayo ng awareness. So, for this particular topic, I just research on the internet, and as much as possible, I research on the things that we could really relate. Kaya, ang nakuha ko is yung Philippine setting. So, according sa Philstar Global, so this article was posted by Antonio C. Sison, medical doctor, on April 23, 2019. So, sabi niya, suicide is an urgent problem. So, in the Philippines, suicide is described as an urgent problem. So, since the turn of the century in 2000, the suicide rate has increased in both Filipino males and females according to the World Health Organizations. So, suicide rate is defined as the death deliberately initiated and performed by a person with the full knowledge or expectation of a fatal outcome. So, alam nila sa sarili nila that the outcome would actually be them dying. So, class, isang tatandaan natin, we're talking about suicide. We are not going to report na successful yung suicide because dying is not really successful. So, we're going to use the term completed. So, reviewing the World Health Organization Observatory Data Repository, the Philippines had the following age standardized suicide rates per population of 100,000. So when we say age standardized, it means that suicide data from different countries undergo a technique to allow populations to be compared when their age profiles are quite different. No, merong standard age lang na nagko-commit ng suicide. According to the WHO from 2000 to 2016, the suicide rate among Filipino males rose from 4.5 to 5.2. So that's sad, tumaas. During the same period, the suicide rate among Filipino females increased from 1.8 to 2.3. So medyo delikado siya kasi people who are really thinking of ending their lives are increasing as the years goes by. So in span of 4 years, ang laki ng percentage na itinaas na, class. So, let us study the basic suicide terms. First, meron tayong tinatawag na suicide attempt. It is defined as a self-destructive act deliberately carried out where there is a clear expectation of death. So, that is suicide attempt. Like, for example, tinry mong taga-tagain yung kamay mo na alam mong pag nadali yung veins, pwede kang mamatay. O kaya, tinry mong tumawid ng kalsada na merong nakalagay na bawal tumawid at alam mong mga trailer trucks yung dumadaan. So, you are expecting that you're going to die in the end. And then, we have suicidal ideation. This is a thinking about death in a passive manner. Bakit siya passive manner? Because maybe some of the people who are thinking of suicide really doesn't have the courage to complete or hindi sila ganong katapang, pero they're always thinking about it, hindi lang nila maiput into action. And then ito po yung delikado, yung suicidal intent with a specific plan. It is when the person has already made plans on how to commit suicide. So, sinasabi dito, class, sa suicidal intent with a specific plan is that the person really is 100% sure na he wanted to end his life already to the point na inaalam niya na kung paano niya tatapusin yung buhay niya. So, yon, with specific plan. And then we have the non-suicidal self-harm is the act of self-harm not intended to result in death. So this type of suicide naman is hindi naman pwede nating sabihin na show off lang. But then again kasi when they are harming themselves, just like parang ang tawag doon, it's a relief for them na akala kasi ng mga tao na nade-depress is hindi na sila capable of feeling something. Na-remember nyo, yung mga may depression, they have this anhedonia na they lack this ability to feel pleasure. And when they are hurting themselves, bigla sila, uy, may dugo, masakit pala, nakakaramdam pa pala ako. So, parang sa kanila, it's a relief na aside from feeling very unworthy, or hindi nakakaramdam ng kahit na anong kasiyahan or interest, na kapag sinaktan pala nila yung sarili nila, parang may bagong emotion silang nararamdaman. So basically ganun po yung nangyayari sa mga taong tinatry na i-harm yung sarili nila. Yun kasi parang na stimulate yung mga ibang nilang senses na parang may dugo, nasasaktan pa pala ako. Kasi usually nagiging manhid na talaga sila, class. So, why does people consider suicide as an option? So, there is no single reason, but one may consider life stressors, health conditions, and financial conditions which may collectively result in feelings of despair and hopelessness. no? Kaya delikado talaga kapag people are really demotivated already na they wake up each morning na hindi nila, na tinatanong nila sa sarili nila na what on earth am I here for? Parang what's the purpose of them still living? Kaya nga importante class na bata pa lang ang mga tao talaga nabubuo na yung kanilang self-concept, yung pagkilala sa sarili. And it's very important na nagsisimula habang bata, and it is being pushed by their parents. So, other factors that are attributed to suicide in young persons is the use of social media, class, which on one hand allows people around the world to connect, but on the other hand may be the platform for cyberbullying and bashing. There is this power sa social media that since you don't know the person who's talking kasi nakatago siya with false names and animosity, ayan, kakamali na, anonymous yung tao na nagpo-post sa social media, they give them this strength and power to say whatever is on their mind, kasi nga feeling nila na poprotektahan yung pagkatao nila ng social media, kasi hindi naman alam kung kanino nang gagaling, and it gives them the freedom to actually hurt other people. Kasi kung natatandaan nyo class, sa social psychology class natin, meron dong experiment na when you let people to actually speak their mind, na hindi mo to kinokontra or binablock, it gives them a liberty to really abuse people or hurt people. So yun yung nangyayari kasi sa social media nowadays, no? As well as yung kapag maraming tao na de-depress when people are being so show off in social media, parang posting the things that they do, na the food that they eat, na kapag nakikita ng mga tao na merong low self-esteem, naaawa bigla sila sa sarili nila, thus heightening the chance for them to really feel very bad about themselves because of the things that they see on social media. And yung iba naman sa sa kagustuhan nila na maabot yung nakikita nila sa social media, mga favorite artists, yung napupuntahan ng mga kakilala nila, they tend to really do things in order to do those same things na kapag hindi nila nagawa, they really feel disappointed about themselves, thus again making them feel bad about themselves na bakit hindi nila magawa, bakit yung iba nagagawa. So that is the bad side of social media. So class, hindi naman lahat ng bagay ay bad about social media. We're just like trying to relate the effect of social media actually with the person in terms of people having this liberty to bully other people because they cannot be seen or they cannot be identified, and also people seeing things other people are doing in social media that makes them feel bad for themselves kasi hindi nila nagagawa para sa sarili nila. So yun po yun class. So they consider suicide because they feel that they are less worthy or less lucky than of the people that they see on the internet. So what are the suicide risk factors? We have the medical conditions. So kapag people try to attempt suicide, no, ito po yung pwedeng maging consequences. So number 1, medical conditions. So this includes chronic medical conditions. The person may feel that he or she is a burden to the family. So another medical condition is the diagnosis of being positive for the human immunodeficiency virus or the HIV. So it is mandated that everyone undergoing the HIV testing should have pre and post counseling to help clarify the understanding of the patient and provide hope for the future. Sometimes kasi, yan, kapag kunyari nagkaroon ka ng sakit, and then nagkataon galing ka sa mahirap na pamilya, you will be thinking of the medicines na iisipin mo magiging pabigat ka sa pamilya mo, kaya iisipin mo yun, wala kang pag-asa na imbes na makatulong ka, ikaw pa yung umahatak sa pamilya mo para lalong maghirap because of the cost of medications. So because of these illnesses, bukod pa dun sa talagang illness nila, magkakaroon patuloy sila ng feeling of depression, thus thinking to commit suicide. And then, what else? Psychiatric conditions. So, this includes psychiatric conditions or mood disorder, which includes major depression and bipolar conditions. So, additionally, substance abuse problems are contributory to the negative impact on mental health and may increase the suicide risk. Of course, people who have psychiatric conditions are really susceptible for ang tawag dito, attempting to do suicide. It's because siguro hindi sila conscious, katulad nga nung mga tao na may mood disorder na sa sobrang hyper nila or nasa manic episode sila, they could really harm themselves kasi napaka-impulsive. O kaya naman yung mga tao na depressed, it's because they really lack the motivation to do things, feeling nila lagi silang nire-reject, so they really wanted to escape the harsh society or world they think they live in, and other psychiatric conditions. So ayun, relationship stress, okay, this may include issues within the family, friends, and love relationships. So at times it may be a combination of all three, which increases the risk for suicide. So really, class, it's really important for us to really build a family which is nurturing and also a family which is open with one another, because mind you, the primary cause of suicide, really ang itinuturo ng mga tao is their problem with their family members. Kasi yung medical conditions and psychiatric conditions, those are actually, kung mapapansin mo, yeah, may sense kung magsisuicide ka just because wala kang pambayad sa pagpapahospital mo, kasi there is a reason why you feel low. Dun sa psychiatric conditions naman, it comes like a consequences ng pagkakaroon ng mga disorder. Whereas dito sa relationship stress, pwede naman din kasi tayong makatulong sa tao in order for them to feel happy and good about themselves. But because we cannot really control other people as well, may mga pagkakataon na nagkakaroon tayo ng problema with them, and kapag ang tao mahina yung kanyang coping mechanism, talagang makakaisip siya na mag-suicide. That is why lagi ko sinasabi sa mga students ko is that you can never really live alone. As much as possible, you only need one person to talk to. And ang pinakamahirap dito is kapag kahit sa pamilya mo, hindi ka makapagsabi. No, kayo, class, na mga estudyante, if ever you're going to build your own family in the future, sana naman gawin po natin ito na nasa tama, not because biglang nakabuntis, or hindi ko naman sinisisi yun, class, no, pero gawin po natin in process yung pagpapamilya, because it's not really just having a family, but it is really becoming a responsible adult na kailangan sa pagpapamilya nakaplano, okay, na alam mo na may responsibility ka with your future children and your wife, kasi nga most of the problems or most of the reason ng mga tao na nagsuicide is really coming from the mishaps or problems within the family, and it's just really sad kung dun pa talaga magsisimula, class. Dapat kasi yung pamilya yung nagbi-build up ng ating self-esteem and self-worth, thus magiging buo yung pagtanggap natin sa sarili natin. And then lastly, yung stressful life events. So this may include the death of a loved one or changes in financial status of the individual, including the collective stress of academic requirements and examinations. So this is also true, nakakalungkot that some students are really committing suicide just because they fail to they fail their examinations or courses. No class, let us not make this difficult, this study. Again, pwede nating sabihin na grades na grades lang yan, ganyan. The problem kasi is how are we going to take this things na nangyayari sa atin. It's really the attitude that we have, no? Tandaan nyo, pinaka-importante yung mga sarili nyo po, no? Sa buhay, class, merong ups and downs. So, ang pinaka-importante is how are you going to handle these things. Hindi siya magi-stay na naka-down. Tandaan nyo po iyan. And especially, always have someone to talk to, even one person, class. So, what are the warning signs of suicides? So, tignan nyo. For example, meron kayong mga kaibigan who are parang feeling nyo, nagbabago siya, hindi na siya yung katulad ng dating kaibigan nyo. So, you have to be aware. Tignan nyo yung kanyang content of talk. So, this is when a person talks about dying or wanting to die. At that time, it may be expressed in a joking manner. Please remember, class, that joke is actually 50% true. Now, when a person is jokingly talking about suicide, diretsuhin mo siya, sabihin mo, naiisip mo bang pakamatay? Kasi doon parang bigla silang magkakaroon ng ang tawag dito ng takot about their own lives. No, you have to really tawag dito confront yung tao. No, alamin mo bakit ba't mo naiisip magpakamatay? Ano nararamdaman mo or may problema ka ba? You really have to listen to them and iwasan mo yung magsasuggest ka ng kung ano-ano. Just have to be there for that person and then acknowledge or ask them bakit sila nakakaisip ng ganun. Next one is change in behavior. So this is very important to note. The behaviors to observe include oversleeping or not sleeping, overeating or not eating. Note also the changes in grooming, personal hygiene, and dressing. Makikita mo talaga yung hygiene, class. No, kasi healthy people really are into ang tawag dito, into making themselves presentable to other people. No, kasi as human, we really wanted to be accepted. So kapag hindi na sila nag-groom, mabaho ininga, hindi tututbrush, hindi naliligo, ibig sabihin they really wanted people to get away from them. Okay? And isa pa po, yung change in behavior, malalaman mo naman hindi naman kasi agad-agad magbabago yung ugali ng isang tao. Pag nakita mo yung friends mo, parang ibang-iba siya dun sa talagang nakilala mo, baka there's something wrong. You need again to confront and ask that person. No? We should try to be compassionate, last. No? Saying hi to other person or mag-smile ka lang could really lift up their mood. Merong mga articles ako nababasa, may mga tao na naiisip nila magpakamatay but sometimes one hello from a stranger could actually save their lives. So maging friendly tayo, ganyan. Huwag tayong maging cause para ma-feel bad ang ibang tao. Last, the change in mood. Notice any erratic changes in mood. So this would include the person reporting feeling depressed with thoughts of being unworthy, or the person may have sudden episodes of being super positive, optimistic, and energetic with so many ideas flooding in. So eto na yung parang meron ng bipolar tendency or yung hindi pa naabot yung mga requirements for bipolar, pwede natin sabing cyclothymic disorder, yung may mga symptoms ng hypomania at saka ng depression, class. So as a psychology student, you have to be very knowledgeable about these things in order also to help our kapwa tao, class. Okay? So, here is a common suicide myth. So, it is a myth that asking about suicide will put suicidal ideas into a person's head. Katulad ng sinabi ko po sa inyo kanina, you have to confront them. So this is not true. If you ask someone if they are having suicidal thoughts, the person will likely admit having them, but asking them will not put suicidal ideas in their mind. No, they will admit, and then they would probably talk about it with you. Nagkaroon na tuloy siya ng catharsis na ilabas niya na yung sama ng loob niya. So therefore, it is important to ask, but bear in mind that the manner and approach to asking is important. Hindi mo sasabihin na, ba't kang papakamatay? Gawin mong in a friendly note. So, why do you have these thoughts? Anong nararamdaman mo? Ikaw yung maging daan para ma-express nila, class, yung sarili nila. Again, the tone of the voice and the manner of talking should not be joking manner. Kailangan makita nila din po yung sincerity mo. Okay? What else? When a person has made a previous suicide attempt or has non-suicidal self-harm behavior, there may be skin scars that one should be alert to. Typically, they may hide the scars by wearing long-sleeve clothing to cover the scars, or some individuals may have covered the scars by having tattoos done. For this reason, it is important to ask about tattoos and what they mean to the person. So, maging mapagmatsyag ka, class. Usually, yung mga may taga-taga dito sa bandang kamay, so yun yung titignan mo. Lalo na kung kaibigan mo yung malapit, kailangan yun din yung maganda sa atin, no? Maswerte yung mga tao na magiging kaibigan natin kasi we know these things. So, magiging observant tayo, class. So, if you are concerned about someone, what can we do, class? Una, be a friend. So, ask gently if you can talk with the person privately and express your concern and offer what support you can provide. Be patient, listen, and consider that you may need to approach and engage the person several times in order to earn his or her trust to confide in you. Hindi siya sa isang upo mo, sasabihin niya lahat yung nararamdaman niya sa'yo, class. If you happen to know a friend whom do you think merong suicidal thoughts, parang gawin mo siyang therapy na kahit man lang araw-araw maglaan ka ng oras to actually text him or her na kamusta ka na, yung pinag-usapan natin kahapon. Just keep on checking on them, no? Kasi para ma-divert yung attention nila, and then also para hindi sila lagi yung nagmumukmok, no? Kasi kapag ang tao walang kausap and then malungkot pa, ito yung mga bagay na pumapasok po sa isip nila. So, should you feel that professional help is needed, consider consulting a psychiatrist, which most hospitals have. For further information, you can call the Philippine Psychiatric Association office at 635-9858 or visit the webpage at http or ppa.philpsych.ph. So, again, class, life is very important. So, be a friend to anyone, be friendly. One smile to any other people ay malaking difference na with them, class. No, as a psychology student, a future psychology professionals, this is our responsibility in our society. No, class? So, I hope you get so much about this lesson, class. And once again po, for the next week, please prepare your video lecture. So, I think Miss Bernabe yung mauuna po. So, good luck po, class, and answer our activity in LMS. Thank you!